A student gives the wrong answer. You know it's wrong. They probably sense it's wrong. The room goes quiet. And in the next 3 seconds, most of us do the exact same thing. We correct it, we explain the right answer, and we move on. I did it too, for years, and it felt like the right move. You're efficient, you're accurate, you're keeping the class moving. But those 3 seconds and what happens in them may be the single most important moment in the entire clinical judgment curriculum, and we've been trained to skip it. So let's talk about what you actually lose when you correct too fast. The moment you hand over the right answer, the student who answered stops thinking. There's nothing left to work out. Everyone else quietly files the correct answer away, and nobody has learned anything about how to reason. They've only learned what the right answer was this time. But here's the worst part: the student who was wrong now knows two things: that they were wrong, and that the path to being wrong again is to think out loud. So next time, they'll wait. They'll let someone else answer, or they'll guess at what you want to hear instead of telling you what they actually think. And the research backs this up. In one study of nursing students, the most common barrier to speaking up was fear of a negative reaction, 64%. And more advanced students were less likely to speak up than beginners. The longer they're in the program, the better they've learned to stay silent. Now, here's what I've come to understand after 47 years in practice and in nursing education. The wrong answer is a diagnostic tool. It tells you exactly where the student's reasoning broke down, which step they skipped, which assumption they got wrong, which piece of data they weighted too heavily. A wrong answer is a window into a student's thinking that a correct answer never gives you. Take a student who says, "I'd give the patient oxygen," when the SpO2 is 97% and the patient is agitated. That's not a random error. That student defaulted to a protocol without ever asking why the patient is agitated. That is a specific, teachable reasoning error, and you cannot see it if you correct before you ask. So when a student gives a wrong answer, you have 3 seconds and two choices. Choice one: correct it. Efficient, accurate, and it produces compliance, not reasoning. Choice two: get curious. Ask the question that opens the reasoning up instead of shutting it down. Not, "That's not quite right. Who can tell me the correct answer?" Not, "Actually, what we want to do here is," something more like, "Tell me more about what you are thinking, the reasoning that got you here. Tell me more about," 4 words, or some version of them, that do something remarkable. They tell the student their reasoning is worth examining, not just their answer. They tell the whole room that thinking out loud is safe, and now you know exactly the information you need to teach. And I'll be honest with you, this move is uncomfortable, especially at first. It means tolerating silence. It means trusting that the wrong answer has something useful in it. And it means resisting the urge, which is so strong for those of us who came from the bedside, to jump straight to the correct clinical response. But the classroom is not the bedside. At the bedside, the correct answer matters most. In the classroom, the reasoning matters most. Because the goal isn't a correct answer in a simulation. The goal is a nurse who can generate that answer under pressure alone at 2 a.m. when no faculty member is in the room to hand it to her. That nurse is built in the 3 seconds after the wrong answer, not in the correction that follows. So this week, let me leave you with one thing to try. The next time a student gives a wrong answer in your class, pause. Don't correct it yet. And ask them to tell you more about the reasoning that got them there. And just see what you find. I think you'll be surprised what's in there. Because the wrong answer isn't the problem to fix. It's the door to the thing you're actually trying to reach. If you want to see what this looks like built into a whole methodology, come find me at lifebeatsolutions.com. Thanks for watching.